Hello, this is the second and last part of this presentation, arthritis of the knees and hips. And as always, I recommend that you watch the first part before you see this one for good understanding of this condition. All right, uh, arthritis does not mean that you will have to be in pain constantly. You can feel better. There are some simple steps you can take that will significantly improve your quality of life. First and foremost, change your lifestyle. If you are overweight, try to lose weight. The most important thing that you can do to help improve your arthritis. Eat healthy food daily. I've discussed in depth regarding this in various topics that are already on the website. So go ahead and see those presentations for more information. Try to be more physically active. One step at a time. Take more steps every day. So from being very sedentary to being somewhat active to being more and more active as time goes on. That should be your aim. Walk for 30 to 45 minutes every day. If brisk walking is difficult, then take slow steps, but make sure that you do that walking. If you cannot walk at a stretch for a half hour or 45 minutes, you can do that in smaller segments. You can walk for 10 minutes in the morning, 10 minutes in the afternoon, and another 10 minutes in the evening. Practice yoga, which is an extremely effective way for muscle strengthening. And these activities will need to be done on a daily basis. Make your bones stronger by drinking at least 2 cups of low-fat milk every day. Skimmed milk and toned milk are available for people who are fat conscious. So make sure that you tell your milkman to deliver this type of milk, and make sure that you also eat 1 to 2 cups of curd every day. Again, this can be made with low fat milk also. Try and maintain good posture when you're sitting, when you're standing, and when you're moving around. And some simple steps that I've elaborated below to help you feel better. Using a heating pad or an ice pack if the joint is swollen or all of a sudden becomes very painful. So that might be of some help. And each time you'd want to use it for about 15 to 20 minutes, and you can alternate heat with ice for more relief. Also using creams and ointments. There's many different kinds that are available in the Indian market. The relief though that you get from using these ointments or creams is usually temporary. Glucosamine supplements are widely prescribed and used. Unfortunately, they are not effective for everyone. After a few month trial, if you're not getting any benefit from taking them, there's no point in continuing to use them. Physiotherapy does have an important role. It has to be done by a well-trained therapist for enough duration to be of any benefit, at least for 4 to 6 weeks, 2 to 3 times a week. And this is basically to help improve your flexibility and hopefully reduce the intensity of pain, in addition to strengthen the muscles so you can move better. Let's now talk about the painkillers that are commonly prescribed for arthritis. The next few slides we are going to be talking about the painkillers, The information that you're about to see might seem confusing and overwhelming when you watch it the very first time. Rest assured, once you've seen these slides a few times, you'll start understanding it better and better. There are three broad categories of painkillers. The first one is paracetamol, commonly known in India as Crocin. The second category is NSAIDs. Just remember that word, NSAIDs. For now, we'll go into more detail in the next few slides. Then there's the others. These might include a combination of paracetamol with NSAIDs. And then there are morphine-based pain medicines which are given for high intensity or severe pain. Let's talk about paracetamol. It is one of the best pain medicines that is available. And by the way, it is not just a fever reducer. There has been a misconception until recently that paracetamol or Crocin is given only for relieving fever, but that is not true. Some well-known brands of paracetamol are Crocin, Dolo, Calpol, etc. There's of course many more brands available. And in the US, one of the popular brands is Tylenol, just so you know. It's effective and safe for long-term use, a very important fact to remember. Has very few side effects, does not cause drowsiness, does not interact with most other medicines, making it a useful addition if someone's already taking a number of medicines for other health conditions and are suffering from arthritis. Keep in mind that the total dose of paracetamol should not exceed 3000 milligrams per day. Overdose, either long-term or sudden overdose, can cause liver problems. The other important category of painkillers is called NSAIDs. The expansion for NSAIDs is non-steroidal anti-inflammatory drugs. Easier to remember as NSAIDs, right? It is one of the most commonly prescribed category of pain medicines by doctors. Now, while paracetamol relieves pain primarily, NSAIDs relieve both pain and swelling. There's hundreds of brands available. There's cheap brands and expensive brands. They have almost the same effects and side effects. Some examples: Brufen, Naprosyn, Indocid, Mobicam, Aciclo. Keep in mind that these are just a handful of examples. There is again hundreds of brands available. But the important thing to remember is that they all fall under the category of NSAIDs. Just to reiterate, there are hundreds of brands of painkillers that are available in the Indian market that fall under this one broad category called NSAIDs. Alright, what are the issues with NSAIDs? The side effects are many. Commonly encountered side effects include gastrointestinal problems such as acidity, stomach ulcer, stomach bleeding, high BP and heart disease. Kidney liver damage can also result from taking NSAIDs for long duration, swelling in the ankles and feet, worsening of asthma in some cases. Therefore, they need to be used with caution, especially if you have heart disease or high BP. If you have ever had a stomach ulcer or if you're dealing with one now, if you have kidney disease, and in certain other situations. Alright, what are the things that you need to be aware of when you're taking NSAIDs? Most importantly, you need to know if the medicine you're taking, the pain medicine you're taking, is an NSAID, or if it contains an NSAID, because a lot of times these painkillers are sold in combination with paracetamol or muscle relaxer. And always consult your physician before starting an NSAID. In some cases, your physician might prescribe additional medicines such as antacids, etc., to prevent stomach problems when you're taking an NSAID. And remember that a brand name costlier NSAID may not be any better than a cheaper alternative belonging to the same family. In terms of its effects and side effects. Bottom line is that these painkillers are not safe for long-term use. Briefly about joint replacement. Surgery is always the last resort and is usually advised for very advanced arthritis. If there is constant severe pain that is not relieved by the usual treatment, and if the quality of life is significantly affected by inability to walk or perform most of the daily activities without any help or assistance, your orthopedic surgeon will and should discuss all available treatment options with you in detail so you can make an informed choice about this decision. Thanks for watching.